My name is Ocean Walker and I'm here today to do an NG tube placement, administering drugs through the NG tube and removal of the NG tube. Today's date is February 28th and the time is 10:30 a.m. So before going to my patient's room, I make sure to get all the supplies that I will possibly need. Provide privacy, do hand hygiene, introduce myself. Hi, my name is Ocean. I'll be your nurse for the day. Can I have your name and date of birth, please? Now check my patient armband to make sure I have the right patient. All right, hi, Mr. Brown. How are you feeling? Good. So I'm here today to do an NG tube placement on you. Do you know what that is? Yes? Okay. So first I'm gonna ask you a couple questions. Do you have any allergies to latex specifically? No. Have you had any nasal surgeries? No. Are you experiencing any sputum right now? No. I'll also assess my patient's level of consciousness and gag reflex. And based off what the doctors may order, I want to go ahead and check my suction to make sure it's working. Put it between 80 and 120. Make sure it is all good, right? I will now set up all the supplies that I will need for the placement. I'll put this towel over my patient's chest. And also the patient will be in the correct working height and the head of the bed raised into a high folders position. I'll put on clean gloves and make sure I have my lubricant jelly. All right. I'll check the patency of my patient's nostrils. I'll use this right nostril right here. All right, I'll go ahead and measure from the tip of the nose to the tip of the ear, all the way down to the xiphoid. Go ahead and mark that with a piece of tape, a small piece. All right, Mr. Brown, now we're going to place the NG tube, okay? And at any point you're feeling any pain or any feeling uncomfortable, I want you to raise your left arm, okay? Good. Now I'm going to lubricate the tip about 4 inches. Lubricate it generously. Okay. Now I want to tell my patient to tilt his head back onto the pillow. I'm going to insert with the tip of the tube facing downwards. Okay, once I hit to the back of the pharynx, I want to tell him to extend his neck forward while having some sips of water. And every 2 inches I go, I want to give him some sips of water. I want to make sure I look in the back of the throat to make sure it's not coiled. Once I get it to where I've marked it, I want to go ahead and lightly tape it to my patient's face. And in reality, the tape wouldn't be this big, right? I would then go ahead and tape this to patient's clothes. And careful to note that when you're going in, you want to make sure you rotate inwards, and then once it is down, you want to rotate 180 degrees. I want to also secure this with a safety pin. Okay, so before taping it to the nose, I want to be able to check to make sure it's in the right place. In the hospital, the correct way of checking for placement is X-ray. So this video I will be doing listening for that swoosh sound in the epigastrium. So I want to get about 30 cc's of air. Okay. And we'll connect it to suction if that's what the order was placed for. All right. So now we'll just keep it like this for the video purpose. Oops. Just secure this tape back. And now I'll go ahead and tape it to the nose. Let me get another piece of tape. Okay. Now be careful. Make sure that stays in place so he doesn't lose that placement. I mean, in the hospital setting, it will stick perfectly to the patient's skin, but because this is a mannequin, it's kind of giving problems. So now I'll just get all my stuff. Oh, and I wouldn't tape it to the towel. I'll tape it to the gown itself. So let me just correct that. Okay. And that is how you insert an NG2. So now that I've gotten my NG2 placed, now it's time for medication administration. So I did my medication checks in the med room. So I did 2 medication checks in the med room. So I'm going to do the 3rd one at bedside. So I'll come in, I'll do hand hygiene. Hi, my name is Oshin. I'll be your nurse. Can I have your name and date of birth, please? And I'll make sure that whatever my patient says matches with his armband. Okay, hi, Mr. Brown. I'm going to administer your medications, okay? All right. And in the hospital setting, this tape will stay in place, but because it's a mannequin, it's not. So I'll go ahead and put on my clean gloves. And I have a liquid med and a pill that was crushed. Before administering the medication, I want to check the stomach content to make sure I'm in the correct spot. So I'm gonna use this pH paper. Rest it in there. I'm going to aspirate some stomach content. Check. And it should be less than 5. Once it's less than 5, then we know that we're in the stomach. And I'll go ahead and instill the stomach content, and it's based off the hospital policy whether you should instill back stomach content or not. Okay. So now we know that we're in the correct spot. We're going to go ahead and flush about 30 cc's. Now I'm going to draw up my liquid med. Okay. I'm now administer my med. Go ahead and flush with another 30 cc's. Now I'm going to draw my crush pill. Make sure I get everything. I'm going to go ahead and flush again. With 30 cc's. Now make sure throughout the procedure I'll be talking with my patient to make sure, you know, that he's feeling comfortable. So I'll go ahead and clean my area. Because now I will be removing the NG tube. Mr. Brown, we're gonna go ahead and remove your NG tube now, okay? All right. First, we wanna get all those tape removed. Of my towel. I want to tell Mr. Brown to breathe in and breathe out while I carefully withdraw my NG tube. Now go ahead and wrap this with towel and discard of this. Okay. And I'll put this in the dirty laundry. So go ahead and lower the bed. Put my patient back into correct, normal, comfortable position. At this point, I'll also provide mouth care, clean his nostril area if needs be, and call light in reach, you know, make my patient feel comfortable. So that's my video of inserting NG tube, administering medication, and removing NG tube.